Children, I hope you have gone through my previous video, and today we will continue further. Children, we are continuing with the chapter Chemistry in Everyday Life. We have to study now about the therapeutic action of different classes of drugs. Now, drugs, depending upon the type of action they are performing in our body, they are divided into several types. First is the antacids. Now, sometimes, in the stomach where HCl is being produced, HCl is an acid. So, overproduction of this acid in the stomach, it causes irritation and pain. This is commonly called as heartburn. It can be treated by using a mild base known as antacids. For example, sodium hydrogen carbonate or a mixture of aluminium and magnesium hydroxide acts as antacids. But excessive use of sodium bicarbonate can make the stomach alkaline and trigger the production of more acid in the stomach. Other important antacids discovered so far are cimetidine, which is also called Tegamet, ranitidine, which is also called as Zintac, etc. Next is antihistamines. Histamines play an important role in vasodilation and in mediation of allergic reactions. It contracts the smooth muscles in the bronchi and stomach and relaxes other muscles such as those in the walls of fine blood vessels. Histamine is responsible for nasal congestion and allergic response to pollen grains. Synthetic drugs, bromophenyramine, this is bromophenyramine, and terfenadine, which is also called as Seldane. In common name is Seldane, and bromophenyramine is called as Dimetapp. They act as antihistamines. They inhibit the action of histamine by competitively binding with the receptor. These drugs do not regulate the secretion of gastric acid because they work on receptors different from those of antacids. Next category of drugs is neurologically active drugs. Now in this there are two types. The first types, they are called as tranquilizers. Now these drugs, they reduce emotional instability, tension, fear, anxiety, and induce sleep. These drugs are called anxiolytic agents. They are also used in relieving stress, anxiety, and irritability. They form an essential component of sleeping pills. There are various types of tranquilizers and they function in different ways. For example, when the level of noradrenaline, which is a neurotransmitter, is low, the signal sending activity becomes low and the person suffers from depression. In such case, antidepressant drugs are used which inhibit the enzymes which catalyze the degradation of noradrenaline. Example of these drugs include iproniazid and phenelzine. Mild tranquilizers, chlordiazepoxide and meprobamate are used for relieving tension. Equanil is used in controlling depression and hypertension. So these are the tranquilizers. Next are called analgesics. Now analgesics are pain relievers. They are the painkillers which when taken do not result in loss of consciousness. They do not cause mental confusion or any other disturbance in the nervous system. Now there are two types of analgesics. First is non-narcotic analgesic. So in non-narcotic or non-addictive, for which you don't get an addiction, analgesics, examples are aspirin and paracetamol. Aspirin inhibits the synthesis of chemicals known as prostaglandins, which stimulate inflammation in the tissue and cause pain. They also reduce skeletal pain in arthritis. They also reduce fever, so they are antipyretic. The medicines which are used for bringing down fever, they are called as antipyretic, and prevent platelet coagulation. Due to anti-blood clotting action, they are used for prevention of heart attacks. The second category of analgesics is narcotic analgesic or addictive analgesics. Morphine comes in this category. It affects the central nervous system as depressant. It causes sedation and slows the respiratory function. And as a stimulant also, it affects the central nervous system by relieving the symptoms of anxiety and causing overall state of euphoria. It also relieves acute pain after surgery or delivery. It is an addictive analgesic. Other examples are heroin, codeine. Heroin exhibits stronger activity, but codeine shows lower activity than morphine. Morphine narcotics are often referred to as opiates because they are obtained from opium, which is poppy. Their overdoses produce stupor, coma, convulsions, and finally death. So they should be taken in controlled amount only and under supervision of doctors. Now next is antimicrobial. Now these are the substances that kill the microbes or prevent growth of microbes. So in this, the first category is antibiotics. Antibiotic is a substance produced by microorganisms, but it is antagonistic to the growth of other microorganisms. First antibiotic was discovered by Alexander Fleming in 1929. It was called penicillin. Antibacterials can either kill, if they are killing, then they are called as anticidals, the microbes, or inhibit. If they are stopping them, then they are called as static. Okay, for stop their growth. So the two categories you see here, bactericidal, that means these are killing the bacteria, and these are bacteriostatic, that means they are preventing the growth of bacteria. So in bactericidal, you have penicillin, aminoglycosides, and ofloxacin, whereas in bacteriostatic, you have erythromycin, tetracycline, and chloramphenicol, etc. Antibiotics which can kill or inhibit a wide range of gram-positive or gram-negative bacteria are said to be broad-spectrum antibiotics. Example of broad-spectrum antibiotic is ofloxacin, chloramphenicol, tetracycline, etc. All these. Alright. Antibiotics which are effective mainly against gram-positive or gram-negative bacteria are called narrow spectrum antibiotics, and example of these are penicillin G. Okay, then the limited spectrum antibiotic is one which is effective only against a single organism or disease. For example, dizidazirine is a toxic against cancer cells. Okay. Next is antiseptics and disinfectants. Antiseptics are chemical substances which prevent growth of microorganisms or kill them, but are not harmful when applied to living tissues such as wounds, cuts, ulcers, and diseased skin surface. For example, furacin, soframycin, Dettol, bithenol is added to soap to impart antiseptic properties. Tincture of iodine and iodoform are used as antiseptics and they are applied on the wounds. Boric acid in dilute aqueous solution is weak antiseptic for eyes. 0.2% of phenol also acts as antiseptic. Okay. Next is disinfectant. Now, see, the difference is both are killing the microorganisms, but antiseptics, they are being applied on the body, whereas disinfectants, they are used on non-living substances. They are harmful to living tissues and they cannot be applied on wounds. For example, chlorine, sodium hypochlorite, very low concentration of sulfur dioxide, 1% solution of phenol. These are all examples of disinfectants. Next comes the anti-fertility drugs. These drugs control the birth rate. Birth control pills contain a mixture of synthetic estrogen and progesterone derivative. Progesterone suppresses ovulation and synthetic progesterone derivatives are more potent than progesterone. For example, norethindrome, the estrogen derivative which is used in combination with progesterone derivative is ethinyl estradiol or novestrol. These are the names of anti-fertility drugs. So this was about the use of chemistry in medicines and in drugs. Next we come to chemicals in food. Now chemicals are added to food to add color, flavor, nutritive value or to act as preservatives. Now in this, the first type of chemicals are artificial sweetening agents. Saccharin. Saccharin is orthosulfobenzenimide. See, this is benzene ring. It has NH group and SO2 group also. So it is orthosulfobenzenimide is 550 times as sweet as cane sugar. It is inert, harmless and an alternative substitute for diabetic patients. It is excreted from body in urine unchanged. Then next is aspartame. Aspartame is 100 times as sweet as cane sugar. It is used, its use is limited to cold food and soft drinks because it is unstable at cooking temperature. Then next is allitame. It is more stable than aspartame and roughly 2000 times as sweet as sucrose. Sucralose is trichloro derivative of sucrose and 600 times more sweeter than sucrose. It is quite stable at cooking temperature and does not provide calories. Then in the food, chemicals are used as food preservatives. They increase the shelf life of food by stopping or slowing down the spoilage caused by microbes. For example, common salt and sugar, vinegar, sodium benzoate, ethylene diamine tetraacetic acid, which is called as EDTA, and salts of sorbic acid and propanoic acid. Food products containing unsaturated fats and oils are susceptible to auto-oxidation, causing rancid smell, so that antioxidants like butylated hydroxyl toluene BHT and butylated hydroxyl anisole BHA, they are added as antioxidants to prevent oxidation or spoilage of food. So in this way, chemistry is used in our daily life. So this finishes our chapter as well as our syllabus of class 12 for this year. So now, in whatever time is left, I will be sending you certain question answers from revision purpose. So you can try and attempt them and start preparing for your exams. Children, we are continuing with the chapter Chemistry in Everyday Life. We have to study now about the therapeutic action of